morning, everyone. I'd like to thank you for joining us on today's webinar on Missouri Children with Developmental Disabilities Waiver Screening Request. I'm Heike Johns, Learning and Development Coordinator for the Division of Developmental Disabilities, and I'll be your host for today's webinar. I'd like to begin with a few housekeeping items. Participants are muted upon entry. However, it is suggested that you mute your line as well. Also, just a reminder, you have the ability to control your viewing of the document, the navigation tools on the top right of your screen. If questions during the webinar regarding the content being presented, we ask that you use the Q&A box. Time allow or questions are quickly and easily answered. Those may be answered during the webinar, but rest assured we will provide questions and answers in a follow-up document of any questions that have been submitted during this presentation. One document, recording of this webinar, and any of the presentation materials all become available. Those will be packaged up. We'll send out an email blast notifying individuals that the information has been posted to our website and is there for you to access. If you're not signed up to receive the division's e-blast, you can do so by going to the DD website. Right side of the screen, you'll see a yellow box that says Get Email Updates. If you click, it'll take you to the registration page. Completion of the webinar, there'll be a brief survey open in your current window. We encourage you to participate in the survey as your feedback is important to us. I'd like to turn this over to Melissa Knipp with the Federal Programs Unit, and her will have Charles Bentley, Medicaid Consultant, and Anna Leonhard, Correspondence and Information Specialist, give you some additional information.
I want to take a few minutes to present a brief overview of the Missouri Children with Developmental Disabilities Waiver, also known as the MOCDD Waiver and the Lopez Waiver. Before I hand the webinar over to Charles and Anna, I want to give you this overview. The information that I am going to present is located on the Division of Developmental Disabilities external website, Home and Community-Based Waivers section. The MOCDD waiver is approved to serve only 366 children. The MOCDD waiver is for children who have an ongoing waiver service need and use at least one waiver service monthly. The waiver is not for children who only need MoHealthNet services, such as private duty nursing. Private nursing is not a service through the MOCDD waiver. To be eligible for the MOCDD waiver, the child must be eligible to receive Division of Developmental Disabilities services as defined in state and federal regulations. The Division of DD regional offices will further determine the eligibility for the MOCDD waiver and if ongoing waiver services are needed for a child. The child will be determined by the Division of DD to meet an intermediate care facility for individuals with intellectual disability level of care and be at risk of entering an ICF-ID institution if not provided the waiver services. They will also be living at home and family and under the age of 18. If determined eligible for the MOCDD waiver, he or she will be placed on a wait list with a prior need score, a date placed on the wait list. Quarterly available MOCDD waiver slots are offered to children on the wait list who have the most critical unmet needs. In order to be considered for participation and placement on the wait list for the MOCDD waiver, a child must be determined ineligible for any regular MoHealthNet program, including MoHealthNet for Kids. Currently sometimes placed on the MOCDD wait list without a MoHealthNet eligibility determination. Families are often told to obtain a Medicaid denial letter from Family Support Division. However, oftentimes families do not always understand the process and therefore provide FSD with inaccurate or incomplete information in the application process. In line with this eligibility determination, the MOCDD waiver screening request was developed, and this section will now be presented by Charles and Anna.
Thank you, Melissa. As Melissa said, what she was talking about is the determination of what the child needs to be in the waiver and what goes into determining if they can authorize to receive waiver services. Do they medically need those services that are provided through the waiver? Then the next step is so for this waiver, unlike our other waivers, there's a special Medicaid eligibility category for children that does not consider the parent's income and assets. And these things are connected: determination of the need for the waiver services and the Medicaid eligibility in the special income limit category, or what we refer to as the MOCDD Medicaid category. But they're related. But what we've done in the past is we made you, because of the limited slots, we've required people to make application for other Medicaid categories, be elected, then have to apply again to get put in the special category for the Lopez waiver. And we really look at the eligibility rules to be in that Medicaid category for the MOCDD. To be determined eligible is the child has to have a disability. Well, everybody that we're considering for waiver services is going to meet that requirement. We have to provide medical records to establish that. Then the child has to be authorized for a waiver service. And if authorized for the waiver service, then FA only needs to verify the child's income and the child's assets. If the child's income is below the income limit, which I believe is $13.11 a month, and the child's assets are below the asset limit of $3,000, the child is eligible. So as far as the eligibility category goes, there's no requirement that actually has to have applied and been rejected for another category. It's just that we want to limit, since we have a limited number of slots, we don't want to put children into the waiver category if we can cover them a different way. So, but this, as Melissa said, this is always confusing, and it just seemed like adding steps to the process that were unnecessary. So what we've tried to do now is we've decided we could streamline the process and develop, instead of making the parents apply twice for the child, first we would have them do screening to see if the child is potentially eligible in another Medicaid category. And doing that, what they would do is they would look at what's the family situation, the parent's income, what are the parents' assets, what's the child's income, what are the child's assets. If the parents' assets are above the asset limit, the $3,000, then we know that the only potential Medicaid eligibility for the child is through the waiver category. If its income is CHIP limits, then also that's the only possibility. Then you look at the parent's income. Well, the parent's income will never make the child ineligible for the regular Medicaid for disabled children category. It will either make them a spend down or a non-spend down. So parent's income would allow the child to receive disabled coverage at a non-spend down. Then we want them to apply that way and be determined eligible that way. If you're going to be a spend down, that's where we get into having to make a decision whether or not we should have services in the MOCDD waiver so that the child doesn't have a spend down, because it's the parent's income is what causes the spend down, or is it reasonable to expect the child to spend down, and therefore they don't need to be authorized in the MOCDD waiver. We can just serve them through some of our other waivers. And in order to do that, it's not a set thing. So what we've done is we have on our website disabled child spend down calculator where you can enter the income of the child and the parents and determine what the spend down would be. In our new process, that information along with verification of the parent income, the parent's assets would be sent in with the screening form that I'm going to talk about in just a minute. And if the child could be eligible with down, then the PU unit will look and determine whether or not they think it might be difficult spend down to meet. They will then refer the case back to the support coordinator, and it is that you would then discuss this child has a $500 spend down. Can they meet that spend down with the other services that they other medical needs, or create a hardship? If you decide that the spend down is so high that the child isn't going to be able to meet that spend down, then that child can be considered and can be authorized for waiver services. If the child maybe had a $50 spend down, it's probably going to be very likely that you're going to, well, that's going to be something they can meet, and they would not need to be authorized for the waiver. The expectation would be they should meet that spend down. $1,000 spend down, you're getting into an area where it's much more difficult, and they're more likely that we would say the only way we're going to be able to cover them with Medicaid at all is if we do it through the waiver. And just in between, and that's where it really gets into looking at individual circumstances before a decision can be made. So I'm going to turn over to Anna and let her go through the screening form.
Is what's on your screen now, and the front part of it is just explaining the purpose, the qualifying factors, submitting the request, and the next step. The second page is the actual form that will be completed by the DD support coordinator or information specialist. And this is an internal form. Do you have the second page? Okay. It looks like second page available. The second page pulled up. Just give me a second. I'm sorry. I'm trying to pull up the second page. Okay. It's not a great representation. We kind of hack it to get it to go up through this program, but you can get an idea of what it's going to look like. So this will be out by the support coordinator or information specialist, and filling out the consumer's name, that would be the child's name, their date of birth, and their DMH ID, their permanent address, that would be their parent's address, guardian's address, and the phone number. If they're receiving inpatient care, if they're in the hospital or out of the home, you want to enter that information, the name of the hospital facility, their admit date, and if there is anticipated discharge date, you want to include that. Then for income, so we've got two categories, parent name. If there is more information than there's room for on this form, you can include that. So if there's 4 income sources, you include that with the email. And you want to enter the income source and then the gross monthly income, and that's the income before taxes are taken out. There's the balance of all of the checking accounts, savings account, and other resources. That would be stocks, bonds, trusts, things like that. And again, if you feel like you don't have enough room, emailing this to me so you can provide more information in the email if need be. There's a small field for other information, such as if the client has private insurance, which may impact eligibility depending on the program. Give me your name, your phone number, and your email address so I can make sure I can get back to you. And then we have 3 check boxes that say verification of all income, verification of resources, and copy of spend down calculator results. Link on page 1 to that spend down calculator. So I want to save that and include it in the email to me. What I'll do is I'll take a look at all of the information received and I'll run a screening to what, if anything, the client is eligible for. So the of it, which I'm not sure came through when we hacked up, so it says screening confirmation from the DSS Family Support Division, and it's going to be a box at the very bottom of page 2. And it then says, the screening letter provides only an estimate and is not an official Family Support Division eligibility determination for internal use only. So something that you don't want to give to the client because this is an eligibility determination. And then the box that will say, the provided verification of resources shows that the client is over the Mo Health Net for Disabled resource limit. The considered resources are as followed. So what I'll do there is I'll look at any check account, savings account, stocks, bonds, other investments, etc., and I'll see what Family Support Division considers as an available resource. No. To this email. Question in the first page, it goes to DMH Medicaid eligibility at dmh.mo.gov. And my name. So we considered resources, and I say either the client is under the $3,000 limit, in which case I wouldn't check that box, or the client is over, in which case I would check that box and explain what resources were considered. The next box is the provided verification of income shows that the client is over the Mo Health Net for Disabled income limit to receive non-spend down coverage. So if the client will have a spend down, I check that box and I would say what the spend down would be and what income is reported. And that's basically what that box will be. Then I send the form back to the support coordinator or information specialist who filled it out. And why did they do that?
This all has to be submitted to the Utilization Review Committee.
Submit that to the Utilization Review Committee.
Individual support plan.
Along with individual support plan.
Level of care information.
Level of care information. Are there questions?
the question is, who is speaking now that we send the MOCDD screenings to? Send them to that special email that's on the first page of this, the dmh.medicaleligibility@h.mo.gov. The FPU unit will look at it. They'll then give it to Anna Leonhard, who was speaking, who is our FSD liaison based here at DMH Central Office. But who you send it directly to her, you send it to that special email address, which is monitored by the FPU and myself, because we use it for other things. And you're supposed to put MOCDD waiver screening request in the subject line, so that, for instance, Leslie Bradley, who would be looking at a lot of these with Anna, would know that this is an MOCDD screen. Then what to say is, Anna told you when she would check the two boxes and what the result would be, and what those means. If, for instance, though, say she finds that the resources appear to be under $3,000, or the child would be non-spend down, or the child would possibly be eligible for just the MoHealthNet for Children's category, she won't get either of those boxes, then share that information, and the information will go back to the support coordinator with an email saying the child appears they could be eligible for another Medicaid category, with instructions on how to just then go ahead and submit the application.
This goes to the Medicaid eligibility email first, or to UR first?
It's Medicaid eligibility email first. And the decision is that it looks like it's potentially eligible. If the only potential eligibility appears to be through the MOCDD category, then that's where you get all that other information and send it to the UR.
The question is not allowing me to go back to that initial page of the training. We're going to try to reload that now, and I'm sorry about that technical issue, but it is one document when you download it. Where is it going to be? I think okay, to the registration, and it's also on the federal programs page. It will be. first page again, and that does include the email address to send it to and the link to the spend down calculator.
The question is it now responsibility of the support coordinator to obtain copies of bank account balances and income documentation? That's our intent, that when because the family is coming and talking to the support coordinator, you're working with them, that it's easier for you to tell them that this is information you're going to need, ask them to give that to you, and you submit it along with the screening tool. And when Leslie and Anna get it, the screening tool, they look at what you submitted, and if it's not enough information, they will communicate back and possibly sometimes communicate directly with the parents. But in general, the idea is to make this a simpler process both for the parents, for the FPU, for everybody, that it is to not make the family go to multiple places in order to get the information needed to make this decision. So the support coordinator is working directly with them. So yeah, if you want to be considered for this special Medicaid category and these waiver services, we're going to need to see a bank statement. We're going to need to see verification of what your income is. Questions about the process, or
does the support coordinator need to obtain copies of their private insurance policy? No.
I just need to note that they have other insurance. Having insurance wouldn't make them necessarily ineligible for the MOCDD category, but it helps with the screening. For the Medicaid for disabled children, the regular category, having other insurance doesn't have any effect. As part of the screen, when they look at the parent's income, they'll also look to see would the child be eligible for MoHealthNet for children. And for that, for income above 50% of poverty, if the child has other insurance, they're not eligible. So a family's income could be up to 300% of poverty, and they would be eligible in the CHIP premium category with and if they're eligible that way, we would want them to apply for MoHealthNet for children, approved and pay that premium in order to get services. But the category, the CHIP category, if they have other insurance, they're not eligible. So reporting the insurance, when Anna is looking at the screening, she would see, oh, the parent's income is below this, but wait, other insurance, so it's not a possibility.
No other questions. I think we're done. We'll note with the link and the question and answers section. Later. So we're doing the screen's done before having the parents apply for MoHealthNet, and sort of the whole point is, unless we were making the parents apply twice, and that's a waste of everybody's time. So this allows us to do screening and determine whether or not they even what they apply for.
I mean, the could go ahead and apply for other Medicaid if they want to, but as a general rule, if they're coming in and inquiring about the waiver, they have a general idea that they wouldn't qualify for Medicaid otherwise. So that's why we just don't want to make them have to apply twice. You can determine that, yes, based on a screening, that the only really realistic way for Medicaid coverage for this child is through the waiver.
So this one's for you, Melissa. Will there continue to be a wait list for this waiver, and how is that managed?
Yes, there's always a wait list for the MOCDD waiver, and as I mentioned earlier, that wait list is pulled quarterly, and kids are offered slots based on their priority of needs score.
Before services from URC, yeah?
Gee, what is it? Yes, correct. I can't see it. Sorry.
Just to confirm, screening must be sent in and received back before requesting services from URC, correct? Yes, that's correct.
Yes, that is correct.
Questions? All right, then. Again, there will be an email blast sent out with a link to the audio of this and also a question and answer.